Hold on.
He said, hold on.
Setting. It's like setting up.
It's setting up.
We're live. We're live.
You're live? Hello, everyone. This is Mayor Sean Patterson Howard. Thank you so much for joining us for our Tuesday update. As we said, we'll be giving you updates on Tuesdays and Thursdays. We're an hour late because we had a Zoom call at 3 o'clock with the governor, and so we apologize for our delay. But we're excited because today we have an incredible panel that is joining us for our Tuesday update. And so once I introduce you, if you could wave so everyone knows who you are. We have our Sergeant Michelle Yant-Terry, and she's
Hi.
with the Mount Vernon Police Department. She has come through being impacted by coronavirus. Then we also have our Commissioner of Health for the County of Westchester, Dr. Amler. We also have Ms. Yedida Yehuda, who is the co-chair of our health committee, and she is retired from the Westchester County Department of Health. We have our Lieutenant Basil, who has also come through and made his way through coronavirus, and we're glad to have you. And then we also have our Dr. Gurlane Agnet, and she is a physician at the Mount Vernon Montefiore Hospital, and she is the chair of the Black Physicians Association for Westchester and New York City, well, Westchester and the Bronx, and they are an affiliate of the National Medical Association. So we have a star-studded, very impressive panel of people who have joined us today. And because he's on active duty right now, and we want to make sure that if a fire is called, he has the ability to jump up and run, we're going to start off with our Lieutenant Basil. Lieutenant Basil, thank you so much for your service. Thank you so much for the work that you do for the city of Mount Vernon and how you're serving the residents of Mount Vernon. And we know that you were exposed as part of your work, and you are now back to work. So thank you so much and welcome back to work.
Thank you.
And if you can tell us a little bit about yourself and what your experience was with coronavirus and how you've managed to make it through.
Yeah, so so I got this probably about a month ago. I was one of the first. I was actually the first person that I knew that had it. We were exposed on a call at 10 Claremont. It was a senior citizen rehabilitation center. There was a lot going on. There was a lot of people coughing. It was right when it was starting to like make the news a lot. We left that call. We really didn't even interact with anyone. Just walked in, went to the elevator, went upstairs, went to the room, and literally walked out of the building. That was on a Friday. That was on the 13th, Friday the 13th, go figure. And then on Monday, we came back to work, and on Channel 12 News, that facility was all over Channel 12 News. So at that point, we were like, you know what, maybe we should get tested. So they came, they tested us. Still at that point, we had no symptoms at all, none of us. We got tested, they sent us home. And then literally the next day, I couldn't get out of bed. So I was sick from about Tuesday to Friday. So it wasn't that bad. It was like 4 or 5 days. I was pretty much back to normal by Saturday. But I didn't really have all of the flu-like symptoms that everybody was having. So at that point, I really didn't know what I had. I just thought I just wasn't feeling good. And like I said, I was the first one that I knew that had it. So I couldn't even talk to anybody to see how they felt or whatever. But on Saturday, that next Saturday is when I got the results. At that point, I was already back to normal. I had to wait my 14 days quarantine. I got retested. Everything came back negative, and 3 weeks later, I was back to work.
Well, I'm glad that you're back to work. So when I saw you outside the window today, I was very, very happy to see that you were back on duty, but not just back on duty, but that you were healthy.
Yes.
And I had an opportunity to speak with you when you were home, and that's just so important. So as you said, one of the key things I think that you said just now is that by the time you got your test results, you had pretty much gone through it.
Yeah.
So how did you know what to do? How did you know what to do?
I was treating it like as if I had it, but I wasn't sure. So what I was doing was I was just drinking a lot of the, vitamin C, a lot of those packets. Actually, in the beginning, I was taking Advil, the ibuprofen.
Mhm.
I didn't know not to take that in the beginning. So for 3 days, I was taking that. And my body was, the aches and pains were really, really bad. And then I moved to Tylenol, and that's when I seemed to start getting better.
Now, did you isolate yourself when you were at home? Were
Yeah.
family members taking care of you?
So my sister and brother-in-law, who've been staying with me for the past month because they're closing on a house. They've been staying with me, and my sister is actually pregnant, which kind of concerned me. But the whole time I was sick, I was just staying in my room, um, you know, just coming out to eat. They were cooking, and I would come out, I would eat, and just go back in bed. So I was kind of isolating myself from everybody during that time.
Thank you. Well, I mean, and I think your experience is very typical, that a lot of people might get their results, but if they are not sick enough to go to the hospital, they're really not sure what to do when they're home and how they should work through this and what are the recommendations. So I'm really glad that your kind of guesses really, really worked out for you, but we are far enough along in this pandemic that now we should have really some steady and salient advice to give to people who are symptomatic and who are experiencing some challenges and who have gone and gotten tested, but they're waiting for their results. We should be able to let them know what to do. I'm going to take 1 second to pause and ask if those who are watching could please share this, start a watch party so that people can get really important information. We want to make sure that people are getting good information. Well, I see one more person that just came in, and this is Destiny. Destiny is also at work right now. She works for a nursing rehabilitation center, and Destiny was exposed as part of her work, and I know that she might have to get back to work in a few minutes. So I want to just pull Destiny in so she could share her experience with us. Destiny, tell us a little bit about yourself and what your experience was with being exposed, going through it, and now you're also back to work.
First off, can everybody hear me? Because I couldn't hear for a second.
Okay, we can hear you, yes.
Okay. Hello, everyone.
Hi.
I am Destiny Crump. I am a healthcare worker. I didn't have a very good experience, but I will share it. I started off with a fever around March 17th, and the symptoms progressed from there. Runny nose, coughing, shortness of breath, no taste or smell. That was a very weird symptom.
Yeah.
I don't know, it was a scary thing because I live with my grandmother, who is she's very vulnerable. Coming around my mother, my siblings, it was a very scary experience. I am okay now. I'm back at work. I've been quarantined for 2 weeks. It's been another week since I've been out of quarantine. I'm still wearing my mask, still wearing my PPE. So I'm okay now, but it was a scary experience.
So when did you get tested? So you said about on the 17th of March, you started experiencing symptoms.
Yes.
How did you know that you had coronavirus?
Okay.
Or COVID-19?
At first, the fever, I was hoping that it was a coincidence. But I did go and quarantine myself. I was sent home. Well, I asked to be sent home from work because I was concerned that I didn't want to expose any more residents or staff members at my job. So I asked to be sent home. That was March 17th. I kind of knew once it wasn't just the fever anymore. Once more symptoms started popping up, I was like, okay, this could be something serious. So let me get tested. But I actually did call that day, just in case, March 17th, I called to get tested. It took me about 2 weeks, however, to get tested. It was a pretty long wait time. I got tested April 4th. They called me on April 1st to get tested. The appointment was April 4th. And I found out that I was positive April 7th.
Wow.
Around. So it was a pretty long wait time. It was a scary thing waiting. It wasn't even the test that was scary. Waiting was more scary than the test.
So 21 days pretty much after you made a phone call to get tested, you finally got tested.
Pretty much, yes. ma'am.
Well, about 17 days, and then it took another few days for you to get your results. But by then you had gone through all of your symptoms and you were back on track.
Yes.
So how did you isolate? How did you isolate yourself when you were in the home? About how many people do you live with?
I live with about 4, 5 people.
Okay.
Because I have siblings that go in and out. But I'm fortunate enough to live in a big house where I was able to quarantine myself on a completely separate floor of the house by myself. I mean, I had no contact with anyone. The door was locked. You couldn't get in or out unless I unlocked it.
Mm-hmm.
So that was a very fortunate circumstance for me. I know not everyone is that fortunate, which is that's a concerning thing, but fortunately I was able to do that. I was eating right. My mom had me eating right. She was feeding me fruits, vegetables, everything that you could possibly think of to boost my immune system. I mean, gallons of water. I had everything I needed in there. So it was pretty very fortunate circumstance for me.
Good. What advice do you have for people who feel they might be having symptoms? I'm going to ask this to you and Lieutenant Basil. What advice do you have for people who feel they might be experiencing symptoms? What would you tell them to do?
If you're experiencing symptoms, definitely call your doctor right away, because your doctor can get you a referral to get tested quicker. Call the testing sites, whoever you need to call to get a test. Do it immediately. Stay inside, quarantine yourself. That's a big part of it. You know, a lot of people are outside walking around. I've seen people quarantine parties outside. I don't know what is that about, but that's not what we want to be doing right now. You want to quarantine, you want to eat right. Eating right is a big thing. You know, my immune system was shot before I went into quarantine, and the fruits and vegetables and the healthy water, everything, staying hydrated, that helps a lot with the symptoms. It definitely does. But yeah, I would just say be strictly quarantined and taking care of your body. Get rest, eat right is the main things.
Thank you so much. If you have to jump off, we'll understand. And if you're able to stay with us for a while, it'll always be appreciated. Lieutenant Basil, do you have any advice? I mean, you know, for individuals who are experiencing symptoms, a lot of us self-diagnose.
Right.
A lot of us self-diagnose, and we won't make a phone call because we'll just Google it and try and figure out what to do. Do you have any advice?
That's actually what I was doing. I was laying in bed Googling all my symptoms. I had no idea what I had. Like I said, my doctor just happened to retire like 2 months ago, so I had no doctor. So I literally went online to WestMed and called the doctor that was supposed to have a video like this with me the next morning, but he couldn't get his camera to work.
Mm-hmm.
So I literally went over all my symptoms with him. He told me he wasn't sure what I had. He said just pretty much the advice he gave me was just stay in bed, you know, hydrate, rest, eat, and if it gets a lot worse, or if you can't breathe or anything, then go to the hospital. But I never had the symptoms where I couldn't breathe. Thank God. I didn't really have any of those symptoms like the, you know, sinus. I did have the loss of smell, which is really actually was freaking me out. That was like the main thing that was freaking me out. But yeah, just hydrate. Even just getting up and walking around the house, you know, just trying to like go about my normal routine in my house so that I'm not just, you know, doing nothing, but definitely get rest and drink a lot of fluids, a lot of vitamins. And that's pretty much it.
You might see me look down every once in a while because I'm just trying to see if there are any questions for the panel yet. So I want to pull in our Westchester County Department of Health Commissioner, Dr. Amler. And Dr. Amler, you know, you've heard two people, they're Westchester residents. One is a first responder. He was able to get testing very quickly because that's an arrangement. I know that it kind of been pre-made. Another one is just kind of a typical resident, and it took her about 2 weeks to get a test. Both of them figured out what they were supposed to do because it was the very early stage. But now that we're a little bit further along, can you please give us some advice about testing and what to do while we're waiting for testing and how to move forward and what resources are available?
Absolutely. And I think they both gave some great advice from their personal experiences. And I think they did the wise things. So I guess the most important thing for people to hear is really that if you have no exposure, you have no risk. So I want to thank Destiny because I think she was pointing out that the most important thing that you can do is isolate yourself if you think you're sick. And the fact that she didn't give this to her grandmother is a wonderful thing, because we do know that people over the age of 60, and I happen to be one of those people, don't do very well with this virus. And if they have serious chronic underlying medical conditions, they really don't do very well with this disease. So it's very, very important that we keep our older citizens, our older residents of Westchester, that we keep them from being exposed whenever possible, so that the best thing for them to do is not get this disease. So if they have no exposure, they're not likely to get the disease. So that means that if you have small children, if you've been around somebody that has COVID, if you've had symptoms of COVID, if you've got a cough or a fever or shortness of breath or loss of taste or loss of ability to smell, that's not the time to visit your elderly relatives, because they really don't need to be exposed to this virus, and it could potentially be very bad to them. So as we said, avoid large groups. That's the most important thing. If you go outside and you're going to be around other people, wear a mask. If you're going to a grocery store, you're going to places where there might be considerable people within that building, it's really a good idea to wear a mask. And if you don't have a mask, some kind of covering over your face is always preferential. If you are around people, you notice that they're coughing or sneezing or they appear ill, you want to distance yourself. We do advise 6 feet of distance between yourself and other people. And I would do that even if you were wearing a mask. It's just better, that social distancing, that space can be very important to you. If you develop symptoms, the ones we talked about, it's really wise, as you heard already, to give your doctor a call and discuss with them what your plans are. Really important also that you don't just show up at the doctor's office, because they need to be prepared. They need to be sure that they can deal with you in an appropriate manner. And if you just walk in, you might expose other people. So it's a really good idea to give them a call in advance so they can tell you how they want you to proceed. They may want you to just go for testing if your symptoms are very mild. There is testing now available. As you've heard early on, testing was very, very difficult to get, but now the state is doing a lot of testing, and a lot of hospitals are doing drive-through testing. And so the ability to get a test done is much, much easier than it was before. There is still some delay. It depends on what lab is doing the test. Some of the labs can turn it around in a day. Some labs, if it's going a distance, it may still be 3 or 4 days before you have test results. So that just kind of depends on who is doing the test. I did mention that we want to protect our older residents, and that's very, very important, especially people who have underlying chronic medical conditions. So if they have heart disease, if they have diabetes, if they've got respiratory conditions or renal problems with their kidneys, hypertension, very important to protect these people and try to keep them from getting exposed. If people do have chronic medical conditions and they're older, they want to make sure that they're doing all the things their doctor has told them to manage their disease. So if you have high blood pressure, you want to be taking your medication for your high blood pressure. If you have diabetes, you want to be monitoring your blood sugar and taking the medications as your doctor has prescribed. It's really, as you heard Destiny say, I think very eloquently, it's a time to take care of yourself, and you want to listen to all those things that your doctor has been telling you to do. And so I think that those are really the most important things for people to know. I can give you the number for testing, or you might have already posted that for people, but the number for the testing number for the state is 888-364-3065. And there are a lot of people making calls to that number, so it does take a while to get through. But if you really need testing, I would reach out, try to get in the queue for testing, so that you can find out if this is a problem that's causing your symptoms.
So, as Dr. Amler said, there are state testing sites. There are testing is available. They are not testing sites, but testing is available at almost every hospital that you go to. If you go to the emergency room and you're experiencing symptoms, you have a fever, there's respiratory distress, you can't smell, you can't taste, and you're experiencing multiple symptoms, then most of the ERs will test you. And I know the governor has announced that he is working on opening more testing sites, especially in our urban communities, because we've seen that there's been a disproportionate impact in our urban centers. And so whether in the 5 boroughs of New York City or here in Westchester and Mount Vernon and Yonkers and potentially Peekskill, we as communities, we are still pushing and working to get testing sites here. It's very interesting. We've been tracking our COVID cases here in Mount Vernon, and we have addresses of all of the positive cases, and they're everywhere. So as of yesterday, we had 1146. We're waiting for our updates, but out of 1146 cases, there are over 900 addresses. There are 900 addresses. Now, people have asked if there were clusters, and everyone assumed that there are big clusters in our poorer neighborhoods within Mount Vernon. But what we're finding, it's more of, there might be 5, 6, 10 cases in different buildings on the north side or more affluent parts of our community. And as we went through that list and we really tried to pay attention to that, we said, how are there not any, clusters in Leicester Towers or Centennial Homes or Ebony Gardens? And the conclusion that we came to as a team is because there is less testing accessible to our poorer residents, or they're not getting the information. And other people are going to their private doctors, they're driving to different testing centers, or they're going to some of the urgent cares that are testing. And so that is the reason that we are fighting very hard to make sure that we get a testing center, and that this testing center is placed in the neighborhood and is made very accessible to, all segments of the community, because the people who are most at risk and the people who this disease will progress in, potentially, as we've seen disproportionately to the level of fatalities, are the people that we're not always seeing showing up on our testing results. So we want to make sure that, equitable testing opportunities are available to all of the residents, especially those who we know are predisposed to getting it because they're living in dense neighborhoods, and secondly, who are potentially predisposed to having a much more fatalistic outcome. So I want to just pull back out for a second and jump over to our Sergeant Terry.
Could I add one more thing?
Yes,
before we
yes,
do?
absolutely.
Because I forgot to mention that there are a lot of people out there that have no doctor,
Right.
as the lieutenant was just telling us. And so for these individuals, I just want to remind them that we are lucky enough in this county that we have a number of federally funded healthcare centers that are happy to see people who have no health insurance, who are happy to see individuals who may be undocumented, who might have concerns, that if they go to a doctor, that it might not be safe for them to go to a doctor, that it could cause, ramifications for them or their family. But we have federally funded healthcare centers that are very, very happy to see people, and as well as our hospitals and other clinicians. But I think it's important to remember that they're not going to turn you away. And it's certainly preferential for people to go get care than it is to be very, very sick at home and stay at home, especially if they're having shortness of breath or some of the more severe symptoms. They do need to seek medical care. And we're lucky that we have places where people can go and get medical care within our county.
And I think some of our federally funded healthcare centers here in Westchester, well, definitely in Mount Vernon, is the Mount Vernon Neighborhood Health Center, which is right on 4th Street here in Mount Vernon. In Yonkers, you have the Yonkers Neighborhood Health Center, which is in Getty Square on Broadway. You also have the Greenberg Area Health Center. You have the Peekskill Area Health Center. I know they may not, I'm not sure, is Hudson River Healthcare, are they private or are they public?
No, they're public.
So you have,
And also there's Open Door. So
yes, Ossining Open Door.
There's a number of places where people can go, and they're not going to turn you away, even if you can't afford to pay. They're going to see you and take care of you.
So, you have Mount Vernon Neighborhood Health Center, Yonkers Neighborhood Health Center, Peekskill Area Health Center, Greenberg Health Center, Ossining Open Door, and then you have Hudson River Healthcare. There are also urgent care centers. I know here in Mount Vernon, the Apple Urgent Care Center up in Fleetwood has a sign up, and they're offering testing, and they're bringing people in, and you have to socially distance in order to get and examine a test there. But testing is available. So as Dr. Ambler said, you can call the state hotline at 1-888-364-3065 and get yourself in queue for one of the state testing sites. But if you're also experiencing multiple symptoms and definitely any serious symptoms, you want to go to your local neighborhood emergency room as well. Contact them. Well, most of them have screening tents outside of their facilities now so that you can go over there and they will screen you, and then they'll send you to the proper direction for triage and for testing should you meet testing thresholds. So that's very important.
And I guess the last thing I would like to say on that is that it's especially important if you have elderly family members who live at home alone, that somebody is checking on them frequently.
Yes.
So that if they get into trouble, somebody knows to call for help.
Absolutely. That's very critical that we have people who are checking in on elderly relatives, friends, family members. I know we've talked about the mental health check-ins. We know a lot of the churches, a lot of the senior programs, a lot of the home delivered meal programs are really checking on our seniors. But friends and family, check on seniors. If you have a senior in your life, you want to make sure that you're checking in with them and finding out how they are feeling and make sure that we're getting them help as quickly as is needed. So Sergeant Yant Terry.
Hi.
Hi, can you tell us about yourself and your experience with COVID-19?
Yes, so I work here at the Mount Vernon Police Department, sergeant here, and maybe about a month ago, my husband actually started feeling symptoms, but it was pretty early in this whole pandemic, and we kind of brushed it off as maybe you're just tired, and he took a day off of work. Maybe about 2 days later, I started feeling symptoms. And I had a headache, I had the chills and sweats, and body aches. So I know at that time my job had been giving out emails telling us if we started to feel symptoms, then we need to call a certain number. So I called that number and I was able to set up a testing. It happened to be a Saturday morning. I called, I was able to get a test that same evening, and I got results back the very next day on a Sunday. So that process for me was fairly quickly. And then I probably felt sick it was in waves for me. So maybe the first 2 days was like, okay, I'm fine. But then the next 7 days was pretty difficult. More of the aches and pains, more of the chills and the sweats, more a complete loss of appetite. My husband and I both mirrored each other. We had pretty much the same symptoms. I probably didn't feel back to myself until day 12 or 13 of the quarantine. And so after that, I took just another few days just to make sure that I felt good before I called my job back and let them know that I was ready to come back to work.
And that's important. So, your job needs to make sure that they have wherever you're working, you need to work with your HR or whoever is over kind of COVID exposure at your job. I know in our police department, in our fire department, and in each of our departments here in the city, we have a point person. And you let them know, they work with you to go and get tested. They'll follow up with you on your test results and check in during your quarantine period, and if you test positive while you're being symptomatic. Some people have tested positive and have remained asymptomatic almost for the entire time that they were quarantined. And as you've heard, others have experienced symptoms. And then when it's time to return to work, that's a conversation again that you should be having with a point person on your job to make sure that this is all done correctly. We want to make sure that people aren't coming back to work too early, and we don't want to just make people stay home unnecessarily. It's interesting. Everyone likes to take time off except when you're sick. When you're sick, you really want to get out the house and get back to work, which is the strange thing. And we don't want anyone coming back too soon because we don't want them to experience a relapse. And we don't want to keep people out unnecessarily. And so how did you quarantine? Both you and your husband were at home. How did that work?
We actually were able to get tested together, and we got our results back pretty much at the same day. So we quarantined together, which was a complete blessing because there were days when I felt really, really bad, and he was able to, hold me down. And then there were days where he felt, worse off than me, where I was able to step in. And so we literally took care of each other.
Where'd you send the rest of your family?
Well, in my house, it's me, him, and our daughter. So she was at my mom's house anyway in Mount Vernon. We live up in Brewster. She was at my mom's house anyway because I was working on my midnights at the time that I started to feel sick. So she had been there already for about a week. And so she wasn't around us, which was great. So it just happened to work out. She ended up staying there with my sister. And so we just quarantined together in the house. It was just the two of us.
And so what are some of the things that you did to get through your symptoms? How did you handle it?
Well, the number one thing I would say is our faith really, really got us through. We come from both praying families. So that was number one, and that was key for us, because if you got to keep your mind, because if you look at the news and you look at the Facebook and you get scared, that that alone will drive you a little crazy, so if you have to tell your mind that you're going to beat this, and then you have to get to work. I would advise that you just don't sit there and do nothing. A lot of people want to lay there, they want to sleep, they feel weak, but you got to do something. You got to walk around, you got to move around. We pretty much did most of the herbal remedies that we've been seeing. We did the steams, the citrus and the garlic and the steam and breathing the steam. We did a lot of hot beverages and soups. Even when we didn't feel like eating, we at least kept drinking our teas, and we took a lot of supplements, vitamins and things like that. So that's pretty much what we did the whole time.
Well, I'm glad that both you and your husband are doing better, and that you're back on the grind. And like you said, having your faith and being able to keep your mind focused when going through this is critically important, because there are people who are not COVID positive. And our friend Jackie the other day said on Facebook has become death book. So social media is a place where many have come to escape over the years and have a good time and enjoy themselves checking in with friends and family. But when you go on your timeline and you're seeing sleep in peace, rest in peace, this one, that one is on a ventilator, it becomes very difficult. And then you have other people who will watch the governor's update, Mayor de Blasio's update. They'll watch this, they'll watch Fox, CNN, MSNBC, and every show they can get. And you have people who are constantly sending you direct messages and DMs about, the coronavirus, this and this conspiracy. It's overwhelming. And if you don't find a way to unplug from that so that you can focus on your physical, your mental, your emotional, and your spiritual health, then you kind of fall behind the 8 ball. So, thank you so much for sharing your experience.
And I know you mentioned earlier that our firefighter Basil is on the clock I am as well. So I
Okay.
do have to go, but I do just want to say to everybody watching, if anybody does have any questions or anything that they may want to ask me, feel free to send me a message. We'll chat later, but I do have to go back to work now. I will continue to watch when I can, and I'll answer any questions that anybody might have if they want to ask me anything. I'm available. You can
Thank
find me
you
on
s-
Facebook, Michelle Yant Terry.
Thank you so much, Sergeant Yant Terry. We really, really appreciate you so much. Really, definitely
So much
appreciate
for
you.
having me. And thank you to the panel.
Thank you.
All right.
So we're gonna pull in because she's kind of the auntie here, Miss Yedida Yehuda. Or hold on, because Yedida, can I go to Dr. Agnew first because she's on the clock. She's at the hospital right now. And we want to pull her in just in case she has to jump off as well.
Well, thank you. Thank you, Mayor, for having me on this panel. I really appreciate the work that you're doing for our community. And I want to start by saluting our doctors and nurses in the emergency room, the great work that they are doing at Mount Vernon Hospital. They are really doing a tremendous job. And we want to send a shout out to them. One of the concerns that we have on the field is the lack of early testing.
Yes.
Early testing for people that don't have transportation, cannot go to drive-through testing. We don't have, a lot of the urgent cares don't like to test you. They send you to the emergency room, and the emergency room don't want to test you unless you're being admitted. So I know you've been working on trying to get more local testing in Mount Vernon and in Yonkers. That will help a lot.
I think we're very close.
Okay,
Yes,
because
I'll leave it with that.
okay, that will help to curb we have in Mount Vernon, we have a situation, we have multi-generational homes. You have, like grandchildren, parents, and if one person can be isolated or diagnosed early,
Yes.
therefore we can isolate them and prevent the spread. Because personally, I have in Mount Vernon family members that all 4 of them have the disease only because they were waiting for a phone call to get tested. So it is very important to us to get the testing done. Also, I'm so happy that everything went well for Destiny and Lieutenant Basil and the sergeant. But if we look at the population with pre-morbid conditions, which is mostly our people in our community, they don't do as well. So we need to have a way to do more aggressive treatment. We need to identify them early and give them directions on when to go to the emergency room and not wait to the last minute when they cannot breathe. So we have that, my group, which is the Black physicians, we developed some in our website, some information site for people to go to be able to, mostly physicians can interact, so they can reach out to the patients in the community so that we can give them guidance. We can tell them where to go, when to go to the emergency room, what kind of treatment do they need, because a lot of us don't, we don't know what to do. So the panel here, they knew what to do, but a lot of people don't know. So we have available on our website a lot of information, a lot of educating materials to reach out our population, which is mostly the high-risk patients.
Can you give us your website, Dr. Agnew? Can you tell us your website, and we'll also type it into the comments if you tell us now.
Yes, it's Westchester Bronx BP, Westchester Bronx Society BP.com.
Westchester Bronx Society BP.com.
Yes.
Okay.
Correction, Westchester WestchesterBronxBP.com.
WestchesterBronxBP.com. So
Yeah.
that's Westchester Bronx BlackPhysicians.com. That's your
Yeah.
website.
Yes.
Perfect. We're going to
We
type
have-
that in.
Yeah, we have blogs that we can have doctors asking questions, or patients can go to and ask questions, and we can provide answers for them. We are definitely a support system for the community, which is our mission statement, to help the community. So we are doing everything we can to educate and to give support to the community. I again want to thank you for the work that you're doing, Mayor, because really things are changing, things are turning around. I've been in Mount Vernon for 30 years, so I've seen the change. So we appreciate you. We appreciate everybody else who's out there doing the work.
It's a team effort. It would be easy to try and take credit, but I can't. It is a team effort. I'm surrounded by an incredible team here in Mount Vernon. I have amazing partners on the county level, and that's one of the reasons Dr. Amler is here. Our county executive and deputy county executive have opened up their resources, the Emergency Operations Center for the county, Office of Senior Services, DSS. Everyone has stepped up and really come out to be a partner with us. This is unprecedented, and none of us are experts in this because it's new, but partners are important.
Yes, yes. That's basically what we also on the medical side, we're trying to partner with a lot of the doctors so we can help the community the best way we can. We also have a virtual presentation on Saturday for most of the doctors to log on when they go to the website, so we can discuss how we can further help the community, because most of the doctors that will be listening here are people in Mount Vernon and Yonkers, and that directly will impact the health of our people. So please join us in the fight, because this is a war and we have to win it.
Yes, it is. Thank you so much, Dr. Agnew. I really appreciate you. And I'm going to bring in Yedida Yehuda, and after Yedida, then we will just give everyone an opportunity to give us some closing thoughts. So if you want to queue up your closing thoughts, and if there's anything else that you want to say to our viewing audience. This will be re-aired tonight at 9 p.m. on Facebook as well. People can constantly share watch parties, and we will also download it and put it on our city's website, www.cmvny.com. And it will also start showing probably by tomorrow on our Verizon and Spectrum cable public access station. So for Spectrum, it is channel 18, and for Verizon, it is channel 30. So 18 on Spectrum and channel 30 on Verizon, and they'll just continuously loop, because we want to make sure that the information stays out there and others who are not watching live can get this information. So please, if you are on this platform right now, if you're watching it, share the watch party, tag friends, inbox them. We want people to get this information. So Ms. Yehuda, please, you're a longtime Mount Vernon resident and an expert in public health and infectious diseases in your own right. Welcome.
Thank you. Thank you for inviting me to this panel. And I really am happy that those people who have survived and have done so well with the virus and have come back to share with others were able to share today, because it's so important that people get to see that there are people who have, survived to kind of counteract the negative stories that they see all day, as you said, on the news, on social media, and all of this. So they see that there are people just like them, their same age group, that work, their same circumstances, that are able to get well and get back out there. So there's a lot that has been said already, so there's not that much more that I can add, except that, you touched on mental health, and people need to make sure that they take care of their mental health, because if you're constantly watching all these negative news and these negative things, you can develop chronic stress that can make you also more susceptible to getting the virus and other viruses. And so it's important to take in. That was a perfect time. You're locked in, we're quarantined, read some positive books. And if you have a yard, you go outside and maybe do some gardening or walk or just to do some exercise inside. There are a lot of free exercise tapes, yoga, meditation online on the various TV channels. And so we can take advantage of all of those things to do some of the things that we have not been able to do because we've been so busy. So in a way, that's a blessing to be quarantined so we can focus on some of those things to improve ourselves. As you said, my niece, Sergeant Terry, she's very, very strong on her husband. I'm glad they made it through. We developed some web-based tools to keep connected and to share positive things with each other and help each other on WhatsApp and other mediums. So we're able to reach out by phone, by email, by text to anyone who is feeling ill so that we can encourage them or provide them with any assistance that they need as a close-knit family. So those are things that we can do without any kind of government intervention, just because you are family. Can I talk about the meeting this morning?
Sure.
I know that we had talked about testing the
Hold on.
availability.
Actually, yeah, no. Look, we're gonna have information later this week when we finalize some arrangements. So we kind of have to just wait.
Okay, just suffice it to say then that
But it's good news.
We're actively working on ways to solve the problem of the people who are unable to travel and get tested at some of these other sites where you need to be in a car. We're working on something solutions to that problem. And what's encouraging to me is that we're pulling together our resources in Mount Vernon. We kind of dropped the ball on that for a while, and there was never any disease outbreak or any issue where the county and the neighborhood health centers and our gatekeepers and citizens and the city did not come to the table and try to solve it together. So I'm happy that we are back at the table solving this problem and making sure that anything that's more detrimental can be averted, because we all have to share resources. We're all strapped, we're all short of resources. So this is an opportunity for us to do that. So, I'm just happy to see that. And again, to all the folks out there, stay inside if you don't have to go out. Do not go out. Practice social distancing. If you must go out, make sure that you wear the mask. And just stay home and do something positive. And if you can help, help in any small way that you can.
Absolutely. Thank you so much. So, as Yedida said, there are lots of ways during this time of social distancing that we can still come together. And so just like we're doing this meeting right now on Zoom, usually this is something we'd all be in a room doing together, but because of social distancing requirements, we've learned how to use Zoom as a platform to bring you information. You can do the same thing with your families. It doesn't have to be a Facebook Live Zoom, but you can go right on zoom.com and get a free account and have 45-minute meetings for free with your friends and family and stay connected. I know on Thursday nights, I have one group of friends where we Zoom together. On Saturdays, I have another group of friends. My church services right now are via Zoom. On Sundays, prayer services, people had Easter dinner on Zoom with each other. Most of like 70% of my work meetings that would usually be face-to-face are now on Zoom or FaceTime. And, there's WhatsApp, again, that is free, Facebook Messenger. And then because I haven't seen my mother really for 3 weeks, because my mother has some pre-existing health conditions, and because I'm out here working, I don't want to put her at risk. And my aunt, who is 92, I've learned how to FaceTime with my mom through my iPad, because I have a Droid phone, but I have an iPad, so I FaceTime with my mother, or I'll do Facebook Messenger with her so that I get to see her face. I needed to see her face. I didn't need to just hear her voice. I needed to see her face. And so, there are different platforms that you can use. We're no longer just watching the Jetsons on television. Technology has caught up, and you can see a family member face to face through WhatsApp, FaceTime, Facebook Messenger, Zoom, and I believe they said freeconferencecall.com now has video teleconferencing capability. So you might want to check that out, but you want to stay connected with friends and family. And even if you need a doctor's appointment, there are telehealth opportunities and resources that are out there. So I'm going to go back to our panelists just so that they can have some closing thoughts. And if you can keep your closing thought to about 1.5 minutes, we're going to start with our Commissioner of Health, Dr. Amler.
Well, I want to thank all the heroes out there, the nurses like Destiny, and I love that name because that's my daughter's name, and to the police officers and our EMS who are out there fighting this battle, and the physicians as well. But I want to remind everybody it's a great opportunity for each of us to be a hero in our own way. And if you have an elderly family member or family member with chronic medical conditions, or just somebody who might have, be alone and not really have anyone to talk to and be isolated, pick up the phone, call somebody. If you know somebody who needs groceries and can't get out to do it, go get them for them, leave them at their doorstep. Somebody who needs a book. There's so many ways that we can all be individual heroes to the people in our lives by simply doing little acts of kindness and allowing them to stay isolated and not be exposed to this disease. So I thank you all for every effort you're doing. Yadida, we miss you terribly at the health department. I'm glad
we have her now. We have her.
I know. And Mayor, I really want to thank you for putting this together and for trying to get the message out there that there's really a group of people for whom this virus can be deadly.
Yes.
And they need to listen to the messaging, and everyone else needs to help them, prevent them from being exposed. And for those people, those precious people in our lives that have underlying medical conditions or are older, we do need to protect them, each and every one of us, so that we all live through this epidemic and come out the other side healthy.
Thank you, Dr. Amler. Our Lieutenant Basil. Oh, you have to okay.
Oh, sorry. I would just say, if, not everybody's a doctor or a first responder, but you can also help just by staying home, actually listening to the social distancing policies. I do see a lot of people out. I don't know why everybody's out and not everyone's listening, but I would just say you can do your part by staying home. Ride this out until the end, and hopefully, by doing that, we could flatten the curve and shorten this. Get back.
Thank you. Thank you, Lieutenant. Destiny, have any closing thoughts?
Yes, ma'am. First off, thank you for having me. I really enjoyed being a part of the conversation. To the young people, please stay inside. I see a lot of young people outside, hold on, time out. I got nervous, I'm sorry. I'm sorry. I had this all mapped out. Please go to someone else and I'll come back. Please.
I'll come back to you. Dr. Agnew?
Yes. Again, thank you for having me. I hope this is the beginning of a long, continuous affair that we can do so we can help the community of Mount Vernon and the surrounding area. I really look forward to working with the other physicians to help improve the health of our community. Again, the most at risk are the ones with high blood pressure and diabetes, and those patients need to be attended to. We need to focus on them and prevent them from getting to a point where their conditions are uncontrolled or not well managed. So we really need to focus on that population, because that's the part that I see most of them are admitted in the hospital. They're not doing too well. So we need to concentrate also on early testing, multiple sites, and I know you're doing that. And we then appreciate everything else that the community is doing. Let me make sure my website again is Westchester Bronx Society BP.com. Okay. This way we can reach out. On Saturday, we're having another webinar. So we invite anybody who's listening, they can join and ask questions so we can help further combat this terrible pandemic. Thank you.
Thank you. So that's Westchester Bronx Society BP.com. And again, the state testing number is 1-888-364-3737. 3065. So
Right.
Destiny, you ready?
Yes, ma'am, I am.
Okay.
Please forgive me for my last
No.
attempt.
It's okay.
I wanted to speak to the younger people because I hear from a lot of younger people. I'm 20 years old, by the way. A lot of my friends, I can't get it. It's not gonna kill me. I'm young. I'm healthy. No, that is not the case. Please, when you protect yourself, you're protecting everyone. Please do not let those things get into your head. We understand it may not end in mortality for you, but it could for someone else. So
Well
please,
said.
And also
please.
it can be passed to your parents, your grandparents, to
Yes.
members of the family. Yes.
Yes. So for young people, please stay inside. Comply with what the governor is saying, the mayor is saying. Please comply. To everyone, please stay safe. Take care of yourselves. This is the time when you can be selfish with yourself. Please, everyone, just stay safe and be healthy. And I pray that we all get through this and we get through it together and we stay strong as a community and we make it to the end. That's all.
Thank you so much.
Thank
Good
you.
job,
Thank
Destiny.
you.
Thank you. Thank you.
And Yehuda, your closing remarks?
Yes, I'd like to say thank you to you, Mayor Patterson Howard, for having this forum, and to all of our family and our people on the professionals on the front line of this virus. Dr. Amler, to all of my colleagues and my friends, I know that you guys are, a lot of people are also positive and those are quarantined and working from home. And so, it's important for us to just check in and take care of ourselves first, self-care. Take care of our mental health, make sure that we're whole, take care of each other, call. If you haven't spoken to someone in the last, you think about them, pick the phone and call and just check with them to see how they're doing. If you're a professional and you hear misinformation, quickly correct it and provide the correct information. Point people to the place where they need to go to get tested or to get the correct information or to get treatment. And so we can solve this as a community if we all take part in all of these actions. I think we will do well. We will get past this.
Thank you so much, everyone. And I just want to say again, if you are experiencing symptoms and there are multiple symptoms, pick up the phone, call your doctor. If you don't have a doctor, contact, as Dr. Amler said, our health centers throughout the county, which is Mount Vernon Neighborhood Health Center, Yonkers Neighborhood Health Center, Peekskill Area Health Center, Greenberg Health Center, Ossining Open Door, Hudson River Healthcare Center. Those are our public healthcare centers that you can also contact. The Department of Health is there to respond to calls. They have hotlines and frequently asked questions that are on the county government website. Mount Vernon, we have www.cmvny. We also have our Facebook and our Instagram platforms for Mayor Sean Patterson Howard, for CMVNY, our Office of Emergency Management, our police department Facebook pages have information that you can be updated on. And of course, New York State has a website that you can be updated on. We want to make sure that people are continuing to socially distance, stay 6 feet apart, stay home. Please stay home. If you're working from home, stay home. That's a blessing. You and your family can be healthy, play cards, watch TV, watch movies. I just put some Netflix suggestions up on my Facebook page if you need something to do just to veg out and stop watching the news all the time. And there are a lot of ways that you can enjoy your family. We don't get an opportunity to enjoy our family. We don't get an opportunity to unplug. We've cleaned out the garage and everything in the house right now. And our house is ready to go for spring. But, do some of those things. And by staying home, you are saving lives. And if we stay home now, then we will have an opportunity to enjoy the summer. We know that the weather is getting warmer, the days are getting longer, it's getting sunny outside, and that really makes me want to be able to go outside. But I also know that if we continue to go outside and we don't do something to flatten this curve and stop the contagion from spreading, that it's just going to take us longer and longer and longer to be able to kind of come out of this portion of the crisis. So we want to be able to get back to some more normal activities, but we have to do our job right now by staying home. And the last thing I want to say is, of course, I want to give a shout out to all of those who are on the front lines, our first responders, DPW, water, all of our healthcare workers, whether you're working in a hospital, a neighborhood health center, you're doing home care or working in a rehabilitation facility. For our essential workers who are in our supermarkets, our gas stations, our pharmacies, wherever you're working that is considered an essential business and you're still out there providing the services that we need, we want to thank you. Just thank everyone. Please continue to take care of each other. And if there is a family member or someone out there who has lost someone to COVID and you're interested in telling your story, then please reach out to us. I mean, people asked, they said all they were hearing about was death. So we wanted to invite some survivors on so that they could share their story and how they came through. But we never want to forget those who have lost a relative or family member, a loved one. And you want to come on and share your story because your story is very important to us. We continue to pray for those who are bereaved. We pray for those who are sick, and we're praying for those who have recovered. We're praying for our community. And the last thing that I want to say, and oh my goodness, I almost forgot. The last thing that I want to say is continue to check on your neighbors and your friends. Continue to check on the excuse me. Almost got through without taking a sip of water and talking all this time. Check on your neighbors, check on your relatives, check on your family members. That is so important and that is so critical. And do not stop social distancing. We have put out flyers and we're going to continue to put out flyers. In Mount Vernon and most communities, we are really here to focus on educating the community and not enforcement. So yes, the governor has given us the right to levy fines of up to $1,000, but education is our priority over enforcement. We really need people to do their jobs. We really need people to take seriously the need to stay in home and not congregate in public. And when you are in public, to follow rules of social distancing, not throwing away gloves, not throwing away masks. Those things are very, very important. So please let's keep up this work together. We will hopefully have more updated information for you later in the week or over the weekend as to our efforts and how our efforts are going to bring a testing center to our community. And until then, keep the faith and let's take care of each other. God bless everyone. And thank you all for coming on. I really appreciate it. If you've lost a friend or family member and you want to come on, you can reach out to us. You can send us a message through our Facebook page, or you can contact us at the mayor's office at 914-665-2360. Thank you so much, everyone, and have a blessed day. Take care.
Thank you. Thank you.
Thank you.